guys, I hope you're well. So I thought today I'll come and do a little demo with the microneedling system for home use that I absolutely adore and I tend to stock in my clinic. And this is the AnteAGE home needling system. So it looks like this. And what you get in this home needling system is a complete pack of the actual Dermaroller as well as the growth factors. And they're beautiful growth factors because they are made of bioidentical growth factors along with cytokines and hyaluronic acid. And they are really as close to our body in terms of growth factors as they can be. And so what you get in the kit is, first of all, you get the instructions leaflet that says let's get rolling, which is encouraging enough. So it says let's do it, let's just get rolling. And in there you get the instructions of how to use it, how to clean the roller, and also how many times that's recommended for you to use the needling device. What I also love about it is that it's actually allergy free, and it is suitable for pregnant and breastfeeding women, which not a lot of ingredients or procedures are, so that's really good to know. So what you get in the roller itself is that you get 2 vials of the growth factors, which look like this, and that gives you each and every one of them. Each one gives you about 5 weeks worth of the treatments, and also depends on the area that you're being treating, and if it's a face, a neck, and décolleté, obviously that's a bigger area. So on average, you should have, for that particular, so for the face, you should have 5 treatments worth and another 5 treatments worth. If you're just focusing on the eyes or the lips or the nasolabials, then obviously this would be this will last a lot longer. So with that, you also get the actual device itself, and the device itself looks like this, and I absolutely adore the color. So what you have is a device that looks like that, beautiful transparent wand, and you then have the aqua colored roller with 2.5 millimeter needles in there, and they are evenly spaced and they don't irritate at all. So for today's purpose, I'm not going to use my whole face. I'm going to focus on the areas that I believe are of most concern. And so you can choose whichever area that you want to focus on. You don't have to focus on the whole area, whichever area that you feel is one that you need to really get more attention for. And so for me, I'm going to use it for the under eye area, and also the nasolabials, as well as the marionettes and the lips. And it's actually suitable to be used for the lips too. So I've cleansed my face using my favorite cleanser, and before I actually start putting holes into my skin, I will make sure that I sterilize my skin, make sure it's nice and clean, and I tend to use an ingredient called Clinicept. And I love this. It's more than, I don't use alcohol on my face, I use this. It is really gentle, yet it's bactericidal, virucidal, fungicidal, and it's protocidal, all of those sidals that you possibly can think of, which means it really cleans your face. And it is, the only thing I'll say to you about it is that it smells like a swimming pool. I perfectly love that smell. Some people may not, but I think you will not be offended by it. It's so gentle, and I highly recommend it. Now, we do stock this one, but I also seen it in the leading high street chemist in the UK. They also stock it, so you can get them from there if you want. So I've done that. I used a gauze swab, and I wipe my face, and it's nice and clean. So I start off by using my growth factors, which comes in a roll-on, if you can see, and I literally will just apply. You don't need much, you just need a little bit. Just apply here on the nasolabials, cover the marionettes in the chin area, and I will also draw a little lipstick line on my lips because I'm going to try and also do my lips, and I'm going to also use it almost like a concealer method under my eyes. So I've used that, and I don't need any more than that. So I'll start by actually rolling onto the nasolabial, and I will tell you exactly how it feels. So how it feels like is like tiny little scratches, no more than that. So I go in a horizontal fashion, and then I can go into a vertical fashion. Horizontal fashion, vertical fashion. Try not to sort of roll it while the skin is on the skin, because you might cause yourself a wee bit of an injury, which I'm sure you won't do that. So always lift your roller before you orientate it. And you do the same here. Vertical. Now I have to swap hands, because being a left-hander, the world is upside down, inside out, whatever you want to call it, but it's wonky, topsy-turvy. And then do the same here. Okay. And it really is a very pleasant sensation. So we go. And then now I would need to use the eye in the eye area, so be very careful, guys. Now it doesn't actually hurt at all, just like a little prick, yeah, little scratch. And you do the same here. And I'll really be very careful not to go too fast in this area. And when you're rolling it in this way, horizontal way, be incredibly slow. You really don't want to rush it. I don't tend to get red anyway, but I can see just a slight erythema, only slight. Okay, the last part I would use is here. It's really nice. It's not painful at all. And so there we are. Once you're done with this one, you follow it up with more growth factor serum. Then because now you're sealing it, your channels are open, so they're happy to receive all the goodness of those growth factors. So they're really happy to receive them. And we are done. Now we could then massage it all in and leave it as that, add more ingredients if we need to. Sometimes a lot of people use with the microneedling, home needling system, vitamin C, which is incredible. We can leave it as that, but I would actually add moisturizing factors as well to make sure we seal everything in. But because you're at a depth that you can actually use your products, and they will penetrate far deeper into the skin, as opposed when you use them on their own without actually creating those channels into your skin. Microneedling in this format is amazing, and it should be used as a daily or a weekly routine, so 3 times a week or once a week or twice a week, whichever way you want to do it, but really will make your skincare ingredients work a lot harder for you, as opposed to just using your lotions and potions on their own with your skin intact. What I tend to do afterwards is actually complement it with a BetaGlucan mask. Now I absolutely adore BetaGlucan as an ingredient as opposed to hyaluronic acid, because did you know that BetaGlucan is in fact 20 times more moisturizing than hyaluronic acid at the same concentration? And not only that, it not only retains water as hyaluronic acid does, but it also acts as a powerful anti-inflammatory, powerful cooling agent, and it's a collagen regenerator. So it's a no-brainer for me. when it comes to using BetaGlucan, and we tend to stock this mask in our clinic, which you can also buy. And currently what I'm doing is running a package where the BetaGlucan comes complimentary. The BetaGlucan mask comes complimentary with the purchase that you have for your roller. So you get 1 or 2 sheets just like these that you can use just to really boost up your moisture during your rolling sessions. So I hope you enjoyed this, guys. Just one more thing I needed to say to you when it comes to cleaning your roller. Do make sure that you do clean your roller, and I love to make sure that I use my cleanser to clean my roller as well as when I clean my face before using the roller, so it keeps it nice and sterile, and you avoid any form of any irritation or infection that you might run the risk of having. So always make sure you keep your rollers clean, and you can use it for up to 10 times, and thereafter you can then change it. So this is not disposable. That's the reason why it's an incredible value for money that will get you the most out of your skin. So I hope you enjoyed it, and I shall see you very soon. Take care. Bye bye.